Thing is, you guys don't need to have all the answers, right? I think for you, the most important thing is to know what you want.
Are you thinking about breast implants, but you aren't even sure what you're looking for? We're going to take a deeper dive into the conversation that happens before your consult. So, we're going to break down what you guys need to know about breast implants to know if they're right for you. I'm Dr. Ashley Amalfi, board certified plastic surgeon, and one of your co hosts to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm here with another board certified plastic surgeon, Dr. Smita Ramanadham. Hi, Smita.
Hi, Ash. Hi,
Hi.
guys.
So, we're here to talk all things breast implants, you guys, because some people come in and they have researched the heck out of them and they really know what they're looking for. And some people walk into the office and they're like, I don't know if I need a lift or an implant, and I don't even know the first thing about what I need to do to make my breast look the way I want it to look, right?
Yeah, absolutely. And the thing is, you guys don't need to have all the answers, right? I think for you, the most important thing is to know what you want, right? What your goals are in this surgery. And then that's what we're here for. We're here to talk you through the different types of implants, the sizing, the projection, the fill, all these little details that really can help you get to make your best decision so your goals are achieved. But that's our job, and we're going to walk you through it. So don't come in, don't feel pressured to feel like you need to know all the answers. I think the most important thing is to know what you want.
Yeah, I mean, we like to know what you like about your breast and what you don't. And sometimes that's easier to look at pictures of other people. And sometimes you can just look at your body and tell us, like, I don't like how low my nipple is, or I don't like how when I wear a bra, I have a little gap or a little space, or I don't like how my breasts used to feel really full and now they feel deflated. Just talk to us in, English, you guys, and tell us what you like and don't like, and then sometimes it's good to bring in photos of either what you used to look like that you liked or others who you admire the way that they look. And that helps us have a conversation because no two breasts are alike, no two surgical outcomes are alike. And we want to make sure that we're going to pick the right implant or not to meet your needs. So let's break it down a little further. Like, I feel like when we talk about implants, we kind of always focus on the size, but we should talk a little bit about shape and projection and implant fill.
Yeah.
Where do you want to start? What do you want to start with?
Let's start with the fill, right? Because I
Okay.
think that ultimately is sort of the two main categories, right? Your saline implants, which
Yeah.
essentially is filled with salt water, and your silicone implants, which are filled with the silicone gel. I often tell
Yeah.
my patients, they think gel, and it's not the oozy kind of gel. That's why we
Yeah.
call these gel
Not slime.
implants, right? They're like very well formed. It's like cutting a gummy bear in half. So it's sort of that stiffer type of gel. But the shell is going to be the same, right? So what your body's
Yeah.
actually touching is silicone,
No different.
no different, right? And so I think when I start that conversation with patients, I talk to them about those two categories and what the main differences are, right? Your silicone implant is going to feel more natural in your breast. It's going to feel like a normal, natural breast,
Tissue. Yeah.
right? It's
The
soft.
gel feels more like tissue versus water.
Right. A saline implant feels more like a water balloon. It's going to be a little stiffer. It's going to be a little firmer. And then the other biggest difference is what happens when they rupture, right? So
Yeah.
typically, not always, but typically when a saline implant ruptures, it deflates like a water balloon, right? So
Yeah.
breast is going to be flat. You know it's deflated. You're going to need surgery to replace it.
Yeah.
Silicone implants, they're typically silent. So your breast still feels normal, looks normal, and the rupture is just all contained within the implant itself.
Yeah. And in different periods of plastic surgery throughout history, we've kind of gone back and forth between different devices. And so some people are still kind of worried about silicone implants because silicone implants have had a bad rap and have come off the market and on the market. And they've been really studied, you guys. And so as plastic surgeons, we know the science, we know the good core studies, and we feel really comfortable with silicone implants. And so we don't want you to come in worried and scared. We want to be the one to give you the medical and scientific knowledge to feel confident in your choice. But Smita, what percentage of silicone versus saline are you putting in your practice these days?
I would say I'm probably about 99% silicone.
Yeah.
Right. So I think my saline patients are either my younger patients that are under 22, right? So sometimes I get the 21-year-old patient that really
Yeah.
doesn't fit FDA recommendations for silicone implants. And then sometimes the patients that are just a little bit more anxious, right? They want things to be as like natural as possible. They don't want any extra added risks brought into it, even if we're talking about a 0.1% risk.
Minimal. Right.
And so, they may choose saline. And I have to say, the patients that get saline love their saline implant. They're happy. And you never really know the difference. It's not like you have a silicone on one side and a saline on the other that you can feel the difference of, how firm one is versus the other. So, but I would still say silicone by far is still the most popular. And
Yeah.
that's worldwide, right? I mean,
Yeah.
most of them are putting in silicone implants.
Yeah, I agree. I'm probably less than 1%. I don't know if I've put in any saline in the last year. Um, but maybe one or two the year prior. So very little, you guys. So silicone, we're on, I think, is it the seventh generation? These implants just keep six. These
Six.
implants just keep getting better and the technology has evolved. And every time there's a new one, it goes back through the FDA, you guys. So these implants are studied honestly more than any medical devices in history because nothing keeps coming through like this. So we feel really good about it. So that's the silicone saline thing. Let's talk about projection. So projection is when you hear people say like high profile, moderate profile, and low profile. And that has to do with how far it sticks out from the body. Like if you put an implant flat on the table, does it stick up a little bit? That's low, a medium amount, moderate, and a high amount or a high profile implant. So that just creates that projection in your shirt. And sometimes, not always, that can give you more of a natural result with a lower profile implant, or the higher, more projecting implants will look a little bit more augmented. Your photos will help us with that because we can look at a photo and have a pretty damn good idea how projecting that implant is, and that's going to help us give you the right projection.
Yeah.
What would you say is like your average projection, Smita? What are you putting in?
Yeah, I would say the majority of the patients are getting either moderate or high profile. And I think, my patients, I'm sure similar to yours, really want that natural appearance. I
Yeah.
would say 99% of my patients just want to be natural or they want to restore and get the breasts that they had before pregnancies and breastfeeding. Um, but I think those patients specifically get really hung up on like not wanting the high profile, not wanting it to look unnatural. But but I always tell patients not to get too hung up on the difference between a moderate and a high, right? Because if you're actually looking at the measurements of the implants,
Millimeters.
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 But where it's important is we can really cheat on the width of the implant,
Yeah.
right? And that I think is what's really going to determine how natural or unnatural it looks because you don't want an implant that's like hanging off the side of your chest or
And
giving
hitting your arm.
right.
Yeah.
Every time you put your arm down, you're hitting the implant. That's what's going to be really the biggest difference between that moderate and the high profile. Is with that high profile, we can really get a lot more of a narrow implant to fit your breast.
Yeah. And those are the measurements we take, guys. So you can't really take those measurements yourself. You can, but you want us to be sitting there and helping you understand the dimensions of your chest so we get the right implant that fits your body and is not too small for your chest wall, but also not too big.
Yeah.
And then, so sometimes we might move you between low, moderate, and high profile implants so that it fits in your chest, but it gives you the cup size change that you want. We can talk a little bit about round versus shape, even though that's not that common in the US anymore. Do you want to talk about that, Smith?
Yeah. So basically, the shaped implants are the teardrop, right? So they are actually formed so that the top of the implant, which sits at the cleavage part of your breast, has a slope to it. And then the bottom part is rounder, right? So it literally looks like the profile of a natural breast.
Yeah.
Oftentimes, those implants tend to be the textured implants, and a lot of us really have stopped using textured implants. But what's really neat is with the round implants that we have, they still become teardropped in your breast, right? If you're holding these implants upright as they would be sitting in your chest, they automatically get that slope at the top, the roundness at the bottom. So they look like a natural
Yeah.
implant. so the shape of it is round, which is nice
Yeah.
because even if they rotate or anything like that in your breast, it's not going to cause any deformities or contour irregularities. Um, but then there's this new implant. Do we want to talk about the Motiva implants at all and like the round versus?
Let's talk about how that gel is a little bit different,
Yeah.
um, but it's still a round implant.
Yeah, what's really neat about these implants, so this um, came out, it was FDA approved in the United States in the fall, but it's been used in Europe for the last 14, 15 years. There's over 4 million implants placed. Like these are great implants, but they do have more of, the round implant kind of maintains that fullness at the top, which is really neat because I've been starting to use these implants more in the women that don't really want to be augmented, but they just want to fill out that
Yep.
this depression at the top where they get the gapping. And so the round implants just really maintain the shape and the fullness at the top and give you that cleavage. And the ergonomic is going to be more of that natural, where that becomes almost this teardrop with how that
Yep.
gel is forming. But it's still they're all round implants at the end of the day, as far as the shape, the diameter.
Yeah, so that's the most common thing you're going to find in the United States is that we're mostly using round implants for safety reasons. But if you want that teardrop look, if you want that natural shape, we have implants that are still a round circle, but they will look like a teardrop in your body. And that's what's really important. So we want to know that. Show us your photos. Sometimes it's a little harder for you guys to look at a photo and know what's in there, but usually we're pretty good at knowing what kind of implant is going to fit in your body to give you that look. So we hope that you guys are leaving this with a little more education about the different things that you need to know about breast implants. It doesn't mean you need to know exactly what you want. Bring your like wish pics, come to us with all of the things that you like and don't like, and see a board certified plastic surgeon so we can pick the right implant for you. And thank you guys so much for following Lipstick and Lipo. Follow, subscribe. We're here on YouTube. We're on Instagram. We are on Apple and Spotify and anywhere else. So take care, you guys. We'll see you next week.
See you guys later.